Rivers State is the hub of oil and gas industry in Nigeria. As a result, business and human activities are high. Rivers State is one of the high-risk areas of COVID-19 in Nigeria. As at November 18, 2020, according to the NCDC, the state has recorded 2,916 COVID-19 cases. A stroll along major roads and streets reveal that Nigerians are abandoning the use of face masks and other safety protocols as cases of COVID-19 infections decline in the country, except in banks where customers are compelled to use them. Most means of transportation do not observe the COVID-19 non-pharmaceutical protocols.
As it's Sunday now, nobody feel where the nose mask they work out that's on the thing to worry. You know, feel push the thing normal. And let people not like to wear the nose mask. You see, they fear the COVID-19. They do not too fear that I had to pay because like I said the thing not too strong again as in there before.
I noticed that there's nothing like COVID-19 in this country. Because even there's COVID-19, many people would have died because there's no vaccine. I've seen that will cure it. COVID-19 only affects those in European countries because of the cold weather.
Recently, the state government has announced the full resumption of schools and other public places like parks, eateries and bars, with the exception of nightclubs. Experts warn that the disregard of the use of face masks might increase COVID-19 cases in the state.
As a society, we are running a risk of a sudden explosion of COVID-19 infections. Our people have never really believed, in the existence of this COVID-19, and they have taken it to the next level. No one is wearing masks in public again. People are not observing social distancing. All you need to do is go near any market, go near any motor park, anywhere vehicles load, to see, the behavior of people. In public transport, no one is wearing masks again. Even in hospitals, people are not wearing masks again.
Our people have gone back to their old ways. As far as an average Nigerian man in the street is talking, COVID has come and gone. Sometimes never even existed. So we are going to our old ways of doing it. But just like we said, the risk is high. The churches are getting full-blown. We are seeing the crusades. Sports arenas are getting full-blown. Social centers, eatery centers, hangout areas are still full-blown. So we may be getting back where we are coming from.
In a bid to prevent a second wave of the COVID-19 pandemic, health workers in the state are making moves to increase the awareness on the part of residents.
We shall at least try our best. Like most hospitals, when you go now, we have sanitizers. We had water and bucket for hand washing with soap. And then we make sure we isolate our patients. Formerly in hospitals where you keep 2 patients in one room, now you keep only 1 person per room.
At facility level, various facilities are doing their best to keep sensitizing their patients as they come. And as a body, has taken time on radio, on television to try to still tell people to be aware that we are still living with COVID-19. It hasn't gone yet, and it's not going in no distant time.
The State Ministry of Health tries to ensure that the people are being sensitized on non-pharmaceutical interventions, stressing the importance of the continuous use of nose masks, maintaining social distance, and washing of hands regularly with soap and water.
We're even doubling our effort to make sure that no stone is left unturned on our primary to secondary and tertiary facilities, and encourage them. We thank God we have the political will because the governor is there supporting the health sector.
They also have experts in the field now, working tirelessly to ensure that a second wave does not occur.
The fight for COVID-19 vaccine is still on, and when it does come out, when eventually anyone is approved, be rest assured that the countries that can afford it will have it first. So for us, our best bet is still prevention, and so I urge people to please wear your mask when you're in a public space,
So for this Ember month and Christmas period, we should be very careful. We should obey all the preventive measures of COVID-19. We should make sure that anybody that is coughing is isolated and tested, and if positive, the person should be quarantined. There should be no bias or partiality when you are checking for people who have this thing.
Vigorous testing of persons in the state should be embarked upon to ensure that persons at risk of spreading it to others are isolated for treatment early enough.